guys, welcome back to my channel. So today we're going to be talking a bit about radiation, so radiation therapy. I have recently completed radiation for my triple negative breast cancer, and so I wanted to talk to you a little bit about my experience, the treatment, what that involved, some of the side effects, how I managed them, and how I'm sort of doing post completing radiation. So let's jump into it. So essentially, for me, I was advised by my medical professionals to complete 15 sessions of radiation. And so I did undergo, as you know, a double mastectomy. But despite this, because I had triple negative, grade 3, stage 3, locally advanced breast cancer, the advice was to be, quite aggressive back and to hit it hard and undergo radiation. So I agreed to that and completed my 15 sessions, which basically consisted of going into a treatment every day, so Monday to Friday, weekends off over a course of 3 weeks. Going into radiation, I didn't really know too much about it. I had a bit of an understanding, but didn't know a whole heap. Obviously met with, the doctors beforehand. They explained, the whole long list of side effects, signed my life away, and sort of what the process would look like. But with any treatment, you never really know what you're going to get. Everybody's different. And so I guess you can prepare, but you sort of have to wait and see a little bit how your body responds. The more serious ones that I was worried about is, impacts that it may have on some of my organs, because I was radiating quite a large area. So I had the whole right chest wall and under the arm with the lymph nodes were treated. So I had, a very large tumor, 7-centimeter tumor on the right side. I had lymph nodes that we knew were involved underneath. But what I didn't actually understand until it was explained to me is that we have lymph nodes sort of like all down here, all up here. And these lymph nodes, we actually can't even, if we wanted to, take them out at surgery. So that's one of the reasons why we also do radiation, as they explained to me, to sort of mop up anything that might be hiding. In terms of the process, I underwent I guess they call it like a staging CT scan a couple of weeks before I started, so that they could map my body. And I'm just going to say, I don't know all the technical words here. So I'm explaining it very much in simple language. One of the things that I did do that was highly recommended was to use a breath hold technique. And so the reason for this is that when you hold your breath, your, I guess, organs in your body slightly move. So we're basically, by holding our breath, we're trying to protect some of the organs from being targeted in the radiation. For me, the heart is on the left, so we weren't as concerned about that, but it still does sort of sit more towards the middle. So when you hold your breath, the heart moves like down, so further away. Being on the right side, I had my liver, which did get a little bit of radiation, but again, with the breath hold, it was quite far removed. The lungs, so all of these different organs, we're trying to minimize the exposure. The treatment itself is only actually about 3 minutes. So it doesn't sound like a huge amount of time, but you need to be holding your breath for a total of 3 minutes. So that's not like the whole 3 minutes, but consecutively. So basically, when you're in the machine, how it works is you hold your breath, and it's so smart. It knows to start, zapping you. And the minute you release your breath, it stops. You have a little break, and then you hold again, and you do that as many times as you need until you get to the 3 minutes. So I wouldn't say it was necessarily super hard, but it wasn't easy either. So I guess what I found challenging about it is that the breath hold had to be extremely accurate, and the machine is really sensitive, which for good reason. We want it to be, treating the exact right areas. But when you breathe in, your body moves a little bit, and if it's slightly out like a millimeter, the machine won't work. So when I was breathing, sometimes, maybe in the days I felt a little bit more stress, I would notice I'd breathe through my chest, which sort of throughout the machine a little bit. So it was trying to breathe in a way where you could hold and not impact the machine being able to do its job accurately. But aside from that, it wasn't too difficult to hold my breath. And, you know, the nurses were so amazing. They were so, you know, supportive and let you take as much time as you need. And I didn't get a tattoo. I believe that's pretty old school now. They don't really use that because, again, the technology is so much more advanced. That we don't really need to tattoo. They can line you up very, very accurately. In the machine, you didn't feel anything, you didn't see anything, but you are in the room by yourself. So, you know, at times it can feel a little bit daunting, a little bit overwhelming, I guess a bit isolating. I will insert a video here. Actually, I took a video of me getting treatment one day, so you can actually see a little bit about how the room looks, and give you a sense of sort of what you're going to be walking into.
Try to aim for the top of the box when you go into it. When you're ready, take a deep breath into that box. Perfect. Breathing normally.
Some of the side effects that I got, so the biggest one for me was fatigue. Again, that's pretty normal because if you think about it, what they're doing is essentially killing all your cells, so like good cells, bad cells, and so your body's needing to regenerate them, and that's where the fatigue comes in because your body is working so hard to try and regenerate. And so the fatigue started pretty early for me. And there's not really much you can do. Obviously, just, you know, rest and try and sleep and, you know, just keep moving your body. That's really important, especially under the lymph nodes. You want to keep the body moving and make sure everything's, you know, still flowing. But that does peak about 2 weeks after you actually finish radiation. So most of these side effects, they do actually linger. So as soon as you're finished radiation, that doesn't mean that's in terms of the side effects. They actually can get worse before they get better. The other biggest one that I was worried about was the impacts on my skin. So again, everybody's different. Everybody's body is going to respond differently. But I was worried about that. So I did look into taking some preventative measures. Essentially, most people get like a bit of a sunburn, but it can get quite bad. So the skin can actually go really red, really raw. It can blister. And I've got quite sensitive skin. So I was doing a bit of research on what I could find. And I wanted to actually show you the cream that I used. Now, this is not sponsored in any way, but I found it amazing. It is called StrataXRT. This tube is like liquid gold, and the reason why I say that, 2 reasons, is one, it's amazing and it works so well for me, but 2, it is highly, highly expensive. So yeah, I'm not going to sugarcoat it. This little tube, it is 50 grams. Cost me, I think it was $160 Australian dollars for a tiny little tube. It says here, for the prevention and treatment of radiation dermatitis. I will say I got like hardly any damage to my skin. 50 grams that I use twice a day for 15 sessions, and still now using it a week out. So just to give you a bit of an idea of how much I use for the area, it's quite a large area. About an hour or so before radiation, you shouldn't do it anything less than that, because then it can impact, like it can actually burn your skin more. And then I did it again after at night. And then in between, I did a bit of moisturizing as well with Mugu, which I highly recommend. So yeah, you only need a little bit, but in terms of my skin, I got the slightest bit of redness up the top here, and that was probably where I didn't put it as much because I didn't at the time realize how high it went. So yeah, a little bit of redness around here, nothing here, nothing here. It was like amazing. I know it's really, really expensive, but for me, it was worth it to not have that side effect of my skin and potentially have, you know, worse issues. I would, suggest looking at getting that cream. The other side effect that I had, which I wasn't expecting, was that I felt really sick so really nauseous throughout most of the treatment. And again, I'm not really too sure why. I sort of put it down to, it did cover the liver a little bit, so maybe my liver was a little bit funny, and that's why I felt a bit sick. Obviously it was irradiating the stomach area, but who knows with these things. It could be many things, but yeah, that's something that I also experienced as well. And a little bit of a sore throat because they are, like I said, going quite high up, but nothing too crazy, nothing that a Panadol or two couldn't help. I want to talk a bit about the mental and emotional side, because again, I don't think this is talked about enough in treatment for cancer patients. I found myself to be, quite emotionally vulnerable during that time because I just was tired and not probably getting enough sleep, despite trying to sleep. You know what it's like with fatigue. Going in every day, again, that takes a bit of a toll. Like, even if you don't realize it, like you're walking into a place that, it's, for me, it's a hospital. It feels quite clinical. You've got reminders of other people around you being sick and having to show up every day. And some days that's just hard. So for me, I actually did have a cry at one point during the treatment. I laugh about that now because I'd read of that happening, and I remember when I read of stories of people saying that before I started, I was like, I would never cry in the treatment machine. Like, why would I do that? And it was about halfway through. I just had one of those days. I couldn't pinpoint it. I just wasn't feeling great. I was a bit stressed out. And yeah, I couldn't get the breathing right. So I started getting really frustrated and emotional, and then I just started crying. But obviously I couldn't move because, you can't move at all. So I'm there laying my hands up with the tears just falling, and I couldn't wipe them. And they've got cameras because they can see you and they can talk to you. And I just remember thinking, oh my gosh, like I didn't think I'd be this person, but I was. And that's totally normal. So I guess I just wanted to let you know that it's okay if you do feel quite emotional. It's, it's a lot that your body is going through. Being about a week out now from my final session, I am definitely feeling a lot better physically and mentally. So my body's had a bit of a chance now to recover. I think I've hit the peak of the side effects, and now we're starting to plateau. So I'm not feeling as tired. The sickness in my stomach has started to clear up, which is amazing because there's nothing worse than just feeling sick every day. I think with all these things, when you're in it, it's just a bit like, let's do it, survival mode. And as you start to come out, you can reflect a little bit more clearly. Hope you find this helpful if you are about to do radiation yourself, just to have a little bit of a snippet of what to expect, how to prepare. I will see you in the next video.